inner thighs and bikini and underarm. I do peel underarm, okay? Bikini, not so much. I haven't had great results with this bikini peeling area. It's really difficult because this is an area in women that tends to be darker, and anyway, there's hair growth there. So that is a problem. First I recommend laser hair removal, and then after that if I need to. Okay, but I'm very practical. Elbows and knees, I peel. Okay, I have a lot of patients coming in and asking for elbows and knees. And those are areas where I've become reasonably aggressive now. I mean, I do TCA and I do things like that. Because these are areas where they're safe, you can handle it, even in the darker skins. But elbows and knees, I peel hands and feet. People come in, back peel of course, but that's more for active acne or acne marks. But for feet and hands, people come in saying it's darker than the rest of their body. And nobody tends to apply sunscreen on these areas.
Yeah.
So that's it. Sorry?
And the protocol, are you following the same protocol?
Same protocol. I wouldn't peel more frequently just because it's these areas. Patients don't come in. You want them to peel when they're peeling the face. So when they come in for the face, that's the time you do the other areas. They're not going to specifically come and get their elbows done. Very few. And some of them do, but not so many. Yeah, somebody else had a question? Sorry, little louder. Okay, 15%. I used to use 30%. There was a peel a few years ago, and they said it was very safe, and I went up to 30. Patients are happy. For elbows and knees, yes. And I've been in practice 25 years plus, okay? I never used to say I would peel elbows and knees, and, I just didn't feel that I could really give enough results. Now that I've started doing that and gone stronger, and I keep the patients on home care, and what I actually do is I give them mask peel, and I tell them to use it at home on the elbows and knees. We'll do that too. So that's something I've done, because there's only so much one can do. But if I give them a home peel, a lot of people don't want to spend so much money when they're coming into the office. So when you give them a home peel, they can do it on the elbows and knees themselves, and that works well too.
Here the people
We're in Dubai.
You're in Dubai, yes, I know. But I will tell you, I have patients flying in from Dubai to Bangalore to us also. I know they spend money, but they also expect very high results. Okay, the expectations are a little higher here than certain other countries I've been to.
because of the price.
So therefore you need to be wise about your choice, and you need to also verbalize what you can do. Don't say I have a magic peel, but if you give them a mask peel and tell them to use it at home regularly, that when you're planning TCA and you want to be super aggressive and you want to really go after good skin improvement, then get aggressive with the creams they're using. Make sure they're on a 1% retinol. Make sure they're on a turnover with glycolic. Make sure that they can tolerate the stronger creams before you go straight for the peel. Okay, then you will feel sure that your patient's skin has been conditioned for this. All right? You've got the same nourishing moisturizers. We've got K-Sutic. We've got Panthenol Sutic, which is more moisturizing. It's thicker. It's a heavier barrier cream, and it promotes healing. You've, of course, got the sunscreen. I haven't emphasized enough on sunscreen because it is a given. I mean, it is something that you cannot peel if your patient's not on sunscreen. It's as simple as that. Then, of course, you've got retinols. I use this a lot. I use the Dermalift 5.0. It's got peptides. I use it in the daytime. I use retinol at night. So I've got the patients on the Dermalift in the daytime as a good anti-aging, and I've got the retinol at night. So these are powerful anti-aging creams. Then, of course, you've got the vitamin C's. Now, if you don't want Dermalift, you put vitamin C, depending on the patient's indication, depending on the patient's problems. Okay? Why do you use the Cosmopeel cream? Because it will reduce the inflammation and it will enhance the action of the TCA. This has got lactic, salicylic, it's got citric, it's got retinoid, and it's got vitamin C again. So in the dermoceutic peels, as you've seen, the whole evening we've been talking about this. You've got step 1, you've got step 2, you've got step 3. And you've seen the actives at every level. So this is what you need to convey to your patients. This is not, you're not just doing a simple peel. You're doing a whole treatment here. It's way more than a normal glycolic acid peel. You've seen that, right? This is something more. Unless you believe that, then you have to understand it and believe it, then you can explain to your patients. All right? So what's the standard protocol? Cleanse the face, we saw that. 3 to 4 pumps of your foamer, rub it in, exfoliate, wipe it off. You pour 1.5 ml of TCA, equivalent to 20 drops. You don't need too much TCA, okay? Apply to the face using 2 cotton buds held together. Now with TCA, I use cotton buds because I like to have control. With the other peels, I'm fine with the brush. With the TCA, I will never use a brush. I will always use cotton buds because I can control my application. What you must understand with TCA is when you are doing one layer, that is a peel penetration. Do not layer again and again, okay? Because every layer you do, that increases the depth of penetration. So you must be very, very clear on that. The TCA you apply, you wait for 2 to 3 minutes, you wait to see the frost. Then if you need another layer and you want to go deeper, you put another layer on top. With TCA, you must be extremely cautious with TCA, okay? The same way you will apply all over, but 1 layer all over the face and wait. This is the key thing. If you wait for 30 seconds, you'll say, oh my God, nothing's happening, let me put another. No. Just hang on for a minute, minute and a half. More often than not, that frost will come. So don't be impatient with TCA. There's no timer here. It's you looking at the patient, looking for the frost. Okay? After that, you don't need to rinse. The TCA is a self-turning off peel. That frosting, that's the end point. You're done. So whether or not you wash it off or not, it's not going to make any difference. Contrary to glycolics and the superficial peels, you wash it off, you're getting it off there. It's done. You're stopping the action. With TCA, you can't stop the action. You put it on, it frosts, whatever you do, that's it. You have peel. Okay? Then you use the Cosmopeel, because when you put that Cosmopeel in, you use that moisturizing effect, it'll enhance the action of the peel, and it'll soothe the skin down. So it has multiple effects. Okay? The patient goes home, you can wash off after 12 hours. I mean, that's just normal washing. But this Cosmopeel, again, has actives in it. It will enhance the action of the TCA. Okay? So, light approach. Light approach means conservative approach. Conservative, 15%, frosting level 1, phototypes 3 to 6, and sensitive skin. Whoever's put that in there, that 6 needs to be put with caution. Yes? 4 sessions, 14-day intervals. Now, this is written protocols. You have to look at your patient. It can be 14 days, it can be 21 days, it can be a month. Just because it's written here, you call the patient back, the patient still has flaking, they're still uncomfortable. Don't say, no, it's written 14 days, I got to peel you again. No, you don't. You wait till your patient's ready for the next peel. Medium, you go with 18%. A global approach is 15% and stronger. This is for somebody who's quite experienced with TCA. When you're just starting out, I would say stick with the light approach. Get comfortable with what you're doing. All right? So, Cosmopeel, before and after, Fitzpatrick 3. Okay, Fitzpatrick 3 is good. It's fine. But Fitzpatrick 3 is also with caution. Level 2 frosting, 4 peels, 15%, 8 weeks. So again, if you look at this, the marks are still there. They're not vanished. Yeah? So these are not touched photos. You know, sometimes when I go to conferences, and I lecture a lot at conferences, and I see these magic before and afters. And I'm thinking, in my life, I have never achieved such a brilliant result. You know, there's something wrong with me. And some of them, you know, there's so much out there. There's Photoshop and this and that and all sorts of things. This is real reality. It doesn't vanish. It improves. Okay? Again, before and after. I mean, this is a good result. This is an 18% TCA, but in a Caucasian skin, I would expect to see improvement of wrinkles. 18%, 20%, 30% TCAs can give something close to a facelift appearance in a Caucasian. So in a white skin, you can get great results with TCA. However, you will have a lot of redness after your TCA, which you need to prep your patient for. Okay. Again, nice befores and afters. This lentigen has vanished, and I think that lentigen has been touched with the TCA. So it's almost like doing a cryotherapy. You know, when you do a spot. Okay, 30% TCA, standalone, stronger peel. You want to cover that? I think we'll get you adept with the rest, and then I'll come back in 6 months and we'll see what's going on. And then we'll do 30% TCA. Let's go to demo. Okay, this is all TCA and feel, not for your skin types. Okay, let's do that. Where is that? Back protocol. I think this you might find quite interesting. So why would you peel somebody's back? What are you looking to do? Acne, there's PIH, there's some sort of mark. Some people just like to wear really low clothes and they want a glowing back, like they want a glowing face. Percent, you do one layer, you don't get any frosting. You do the second layer, you don't get it. Sometimes by the third, there are some patients who don't frost till the third layer. But I would still urge you to wait that 2 to 3 minutes. You will see it if you go to 2 or 3 layers. Even with a 15. But then that means your patient just had really good skin and they can tolerate it. It's very simple, otherwise everything stays the same. And then make sure that you rinse off properly. I think that's important when you're doing body peels. Combined with milk peel, of course, we said Sansutic, we said intense moisturizers, oil reducing masks. This mask feed works really well.
Perfect.
Yeah? Okay? So I think you're all getting the hang of it now. Once you understand what everything does, you can fit it into your treatment regimens. So befores and afters, I do a lot of back peels because in India they wear saris and when they get married they wear low backs and everybody comes in for a back peel before the wedding or the kids who've had acne. So it's quite required. Hands, peeling hands. Now why would you treat these areas? Again, in Caucasian skins, this is a giveaway for aging. Yeah, so people like to peel their hands. There's usually a lot of sun damage if they've not taken care of their skin. So hand peeling is something that you can do. Here, TCA, you can do spot application on lentigens. Now that is where I would use it. Okay, so the spot application on lentigens, it's almost like a light cryo spray. It's equivalent to that, okay, to remove the lentigens. Be cautious with it. Again, wait for the frosting. Don't be too much of a hurry. Start with 15 if you want to, or you use 20. Go up stronger. 2 to 3 sessions, you'll find that you'll get really nice results. Okay? Again, follow up with the cream, the Cosmopeel. So that it comes as the kit, follow up with the kit. Apply it, let them go home with that on. Yellow cream, okay, this has got lightening agents in it, so you will follow up using yellow cream. K-Sutic is post-treatment cream, it's got vitamin K, it's their complex, the K complex for healing, vitamin C and E. Photo-aging, now there are many things you can do. One is of course peeling, you can do fillers. There's a lot of hand rejuvenation happening with fillers, filler injections. There's a lot of lasers happening on the hands nowadays. Okay, so hand rejuvenation is a big thing. I think more the Caucasians come in for the hand rejuvenation versus the Asians. sunscreen on their face, make sure they put it on their hands, whatever's left. Put it on your neck, put it on your hands. The neck and décolleté area, this is a big thing for the Asians. They're coming in now because neck changes are visible. So you can start using neck peels. Again, milk peel would be what you would start with. Later on you can look at TCA if there are any lentigens or sun damage or spots. First start with the milk peel. Okay, then you can also look at combining. When you get more aggressive, when you get more experience, you can do a milk peel and then spot TCA. Slowly, get comfortable with what you're doing. Again, same home care regimens. You're going to use a dark spot corrector, you're going to use a healing cream, you're going to use a sunscreen. I can't overemphasize this part enough. It's not just a peel. Get them onto something. And emphasize it's so important for them to do this. You see this damage there, the frosting that can happen, and after this, it's improved. Now look at this and look at this, and this is day 74. You're looking at 2.5 months later. There's improvement. The lentigens have improved. The sun damage has improved. Okay? It's a gradual process. This is not my picture. This is a Caucasian patient. But if you see this, I mean, it takes time to get there. It's not just one treatment. We also combine peels. In my office, we do peels for this area. We combine it with laser rejuvenation. So we actually combine. We'll do a peel, a week later we'll do a laser. Yeah, so this subtle. There's a little bit of a hypo here which you need to watch for. Because somebody with extensive sun damage can get hypopigmentation. Huh? Yeah, it was already there, but what will happen is when you clear up this, it's going to become more prominent. So patient's going to come and say, you did this. So make sure you have the before photos to start with. Okay, elbows and knees, as we talked about. Mask peel is great for this area. Give it to them, let them take it home, let them do it themselves if you don't want to do it in the office, and you do a TCA in the office. Okay. Sorry? Who's asking? Sorry? Yes. Mask peel. I actually, in my office, we tell them twice a week. Yeah, we tell them twice a week at home if they can tolerate it, otherwise once a week. And you know, one jar lasts quite a long time, so they don't mind spending on that. Okay, home care again. Look at this. Make sure that you advise your patients. You have to look at these creams, you have to look at what they contain. My advice to you is look at each cream, pick up one key ingredient in your memory. Like a hyaluronic, you tell the patient, it's got hyaluronic acid, it heals, it's anti-aging. You tell them retinol, it's got the retinol. You emphasize that one ingredient and the importance of that one ingredient. Okay? Choice. What are you looking at doing the peel for? What are you looking at? For pigmentation.
Under skin also.
Just all over. Okay. So TCA, 15%, 18% is going to give a rejuvenation effect. Superficial pigmentation will get taken care of. She needs to just be careful with the sun exposure. So you've used this peel before, right? Some of you have used this peel before, yes? Does everybody do the cleanser like this?
Yes. Yes.
Are you sure?
Yeah.
Yeah? Okay, good. So actually, if you look at her skin and you look at the previous doctor's skin or the previous patient's skin, they were much more erythematous after a 15% glycolic. She's had a 15% glycolic wash. Okay, it's looking very red there. It's really not. This is a light reflection. It's not at all. Close your eyes, keep your eyes shut. Whenever you're peeling, always tell the patient to keep their eyes shut. If you don't need to go too close to the eyes, put a wet gauze on top of the eye and make sure they keep their eyes shut. There have been many incidents of complications with peel. Acid has gone into the eye. As I told you, it's on the hair. That hair laced with TCA has gone into the eye and caused a burn. So you have to take care. Your gloves had TCA on it and they touched the patient's skin. Patient got a burn. So there are many problems. You have to be cautious and careful. She's not red at all, actually. Can you focus on the skin? Yeah, this is really just a light reflection. There's absolutely no redness. Yeah, so she's changing her gloves because the gloves are wet after cleansing and then you have no control again with the acid. So you change your gloves or be cautious. You don't want anything messing up or coming in touch with you. Standard protocols, protection, I mean this is something, don't take shortcuts for these things. You've seen sometimes that acid pools around these areas and if you haven't taken care, they'll burn at these areas. And as I told you, you can get a lip burn. So I wouldn't peel the lips, you know, you can get a burn on the lips. It's so unpredictable because the skin is so thin there, the mucosal skin. There are many creams now which have been launched for lightening the lips. You know, they come as lip lightening agents. But get into the history. Is there a dental history? Is there a history of lichen planus? Is there a smoking history? Find out what's causing the pigmentation. Is there any drug intake, painkillers, all of that?
Mostly like my Indian client,
Yeah, but you know what? Just send them away and tell them you can't do anything.
it's genetic.
Yes, a lot of the time having darker lips is genetic and you can't do it. There's some things you need to leave alone. And even when we're talking about underarm pigmentation, because acanthosis nigricans, look at the causes for that. You know?
Usually like after laser treatment, getting more dark.
After,
That's why it is
it's just they're more aware after they've done laser. Okay, so look for the application of TCA. Honestly, Cecilia is very experienced with TCA because she does it a lot on Caucasian skins. But if you see this, it's extremely single application. There's no overlap. Okay, we're not looking at layers. Now this is the second pass. So she's going to do 2 coats, but this is actually 2 coats. And then you stop.
Exactly.
Okay?
So the main point is, the main thing to remember was what I was saying is really to wait. You see, I'm very patient with the patient. So here you see no frosting. I'm not looking for frosting. I don't know. I don't expect that. I don't know her, so I don't want to go too deep. So when you start with TCA and you don't have any experience with TCA, don't search for really a deep frosting. It's better to do on the first session just a standard and a light protocol.
I'll let her go.
Exactly, and then on the second session you will see how the patient has reacted, and then you can go maybe a little bit deeper.
So that effectively was 2 passes. It was one this way and one that way, evenly covered, and that's it. There's nothing happening, don't worry.
That's fine.
So you can go reasonably close to the under eye area. Like I said, always take the patient to keep the eyes closed. Yeah. And again, TCA with cotton buds or Q-tips. You've got control. Make sure your Q-tips are not dripping acid. Okay, that's very important. That they're soaked. You squeeze it up against the dispenser or container. It should not be dripping acid.
So you can see she's a little bit crying. I hope not from it. No, I think okay. So be careful not to have any water in your TCA due to any tears, if she has.
So she's had a TCA before, okay? This doctor has had a TCA before, so we don't anticipate any problems or any reactions. And it means her tolerance will be much better for a low concentration TCA. So again, make sure your cotton buds are not dripping.
Exactly. So
that's so
can you-
important.
So when you put in
Just
your
see
cotton,
the video. Can you see the camera, please? You
Yeah.
focus on that.
yeah. So when you're taking the TCA, you make sure to always pour the excess on the side. I'm not sure it's very visible.
Okay.
To really avoid any excess. You don't want
Yeah.
any leaking on the
See.
face.
Okay. Like this. Okay.
Yeah, it
Yeah.
shouldn't be dripping. It's very clear. Always keep the acid away from the patient. There have been so many reports of accidental spills. You know, you think you've got it all under control, but sometimes the acid spills. So just take basic precautions when you're peeling. Be very, I would say, methodical when you apply the TCA because you can't see where you've applied. So go in order, do the skin quadrants, finish one, finish there, go to the other side because you might forget what you've done.
So yeah. So it's important not to do the full face. So you work zone by zone, and really finish below here on the jawline to avoid any demarcation.
So that feathering which we talked
Yeah.
about. Yeah? Are you okay? Any burns? You feeling any sensation at all?
On the area.
What do you feel?
Here?
Tingling? Pain?
Little, no, tingling.
Little tingling? On a scale of 1 to 10, what do you feel?
It's okay.
No, what number?
Nothing.
1, 2? Nothing?
Nothing.
Oh, nothing.
Only
Okay.
Only this area.
So probably 1 or 2.
Then it's expired.
You can feel something.
Okay, no, she can
See
feel
it?
something. She's feeling very good, she says. She's just feeling nothing, but a little bit
Very
of
soft.
tingling.
Yeah,
A little
soft.
bit of tingling.
Only this area.
So in this skin type, I don't anticipate an issue. In the darker skin type, you're probably more likely to see a frost, number one. So you have to be just a little careful. If I was doing the same thing on my skin, I would do one layer. I wouldn't even do up and across, I would do one.
If you're more experienced with TCA, and that's really just for people that have more experience, you can really focus on the area you want to treat. So for example, if I want to treat the wrinkles next to the eye, you can really pull the skin to go inside the wrinkle. So that's really up to you what you want to treat, and based on your experience.
Do you have
I
to
start
wait
now, start
until
to-
you see frosting?
Sorry.
Or
Sorry?
do you have to wait until you see
It depends what you want. Frosting will take some time. It takes like 2 to 3 minutes. So that's why I always work zone by zone. So I apply the first layer, and if I want frosting, I know that when all my zones are done, I can start again from 0. But yes, if you want frosting, you need to wait.
Okay, so she's feeling more tingling now than she was feeling before. Okay, the number has gone up. If it was 1 before, it's 2 now. Little more? Oh, great. Okay. You feeling more now? Are you feeling any burning when she's applying the cream?
Maybe I have experience, that's why.
Yeah, possibly. Okay, so Cosmopeel, lactic, salicylic, citric, retinoid, palmitate, and ascorbate. So there's a combination of 5 actives here that's going to potentiate the action of TCA. They all have healing action, okay, in the creams.
Vous parlez français aussi? Oui, je suis algérienne.
Ah, vous êtes algérienne.
Only one layer.
Vous avez la peau épaisse.
Why? Because we haven't prepped her. We don't know her skin.
Mais d'où en Algérie?
She's looking for a textural improvement. We would ideally need to see how she does. Second time when she comes, you can do 2
Je préfère la
layers.
Kabylie, désolée. Ah, mais je me disais aussi, vous avez pas une tête d'Algérienne.
Very honestly, I wouldn't do multiple layers. I would increase my concentration. So I would probably do 2 layers with a 18%. Maximum, I would push to 3, depending how she tolerates. Otherwise, I would increase to a 20% concentration and do 1 layer again.
Mais je suis d'Algérie. Ça vous manque pas? Oui, je l'ai vu descendre, ça m'a- Non, j'ai un frère qui dit genre, il y a en français.
Well, she's done that. We've done the jawline area. Jawline. TCA on the neck, you have to be again quite careful because the neck skin thin is very thin. So you would do one layer, maximum pushing it to 2 layers, but you can peel the neck. It's how much peel you want to do, what you charge for, and how much you use a lot of acid, right? Yes. Yes.
Alors ça, vous
Yes.
12 heures. Voilà. Bah, quand vous allez dormir ce soir. C'est entre 8 et 12 heures.
It's not humanly possible to go to the beach and get tanned everywhere and avoid on the face.
Ouais, mais la
So you have to be careful. If you know they're going for a vacation or they're going to the beach, wait till they come back. And even if they come back from their holiday or their vacation, wait for the tan to resolve a little bit and then. I know, but nobody sits on the beach in this heat, right? Nobody goes out midsummer way out.
Le masque pied, c'est juste pour peau. C'est pour
Yeah, just
la
like
peau.
that.
Et ça, on a rajouté de l'acide salicylique.
And don't peel before, if you know they're going out. Wait till they come back, wait for a week, and then. Most people will tell you summer vacation, we're going somewhere, and they all go to warm places, they all go to the beach, or they all go to
Après le
swimming.
TCA. Ah, mais avant, on fait pas le TCA. C'était sans. D'accord.
Okay?
So she's done. So she has the Cosmopeel on her face. So she will wash it after 12 hours. Now it's already a little bit late, so I think tonight after 8 hours that will be fine for her to wash with water. And we'll also give her some K-Sutic and some Sunsutic to protect her skin from the sun from tomorrow.
Merci.
Postulation now, the dark circles is not just melanin, it's vascular. And if it's vascular, then we use a laser. So you have to be able to differentiate that. Huh? The dark circle you're saying? No, but for darker skins also there are many etiologies for dark circles. Many. You can see if it is melanin or erythema. You're guessing. Yeah. So don't. It's advisable not to. No, you can see pigmentation. I will tell you. If you're using Pico Sure, then you can definitely look at getting Antera. Because you can differentiate, and then if you use a vascular laser, you can see great results. You don't have the vascular? It works very well if you're treating vascular. Look at, like I said again, look at the etiology. Everything stems back to etiology, even pigmentation. It may not be melasma. It may be ochronosis, it may be Reals melanosis, it may be, I can speak for hours on the etiology of pigmentation and give you many courses. So sometimes we say you have to do a biopsy, you need to know what you're doing. It's not just about, okay, this patient has pigmentation, let me get rid of it, you know? So if you can get into the etiology, it's a good thing.
What kind of home care product do you recommend to use aside from the peels? And the third one is, how many sessions would you do on that kind of person? So quite mature skin, but phototype fair. The second one is Dermatology Center, Salwa Adel. Salwa? The third one is Bella Roma Aesthetic Clinic. Jocelyn Manuel. Okay, sorry for the pronunciation. Dr. Wessam El Taba.
Wissam Jabba.
Sorry for the pronunciation. We have another winner, EMC Medical Center. IMC Medical Center, Suzanne David. Oh no, that doesn't count. Dermacetic Mauritius.
Oh, no,
That's one of my distributors. It's very transparent. Nice try, Avinash. This is Avinash. He's our distributor in Mauritius. He came all the way to see you as well. Yeah, he's having a lot of pictures for me. So we have Damas Medical Center, Marina Oglu? Marina. Dr. Abdullah Anis from Marina Medical Center.
By the way, till now nobody's from Abu Dhabi, so
He's trying to mix the papers from Abu Dhabi, but somehow it doesn't work. Sorry. We have Dr. Abir Ibrahim from Zara Esthetica Medical Center. Okay, we have one winner, Nice Care Medical Center, Noah. It's you? Only 2 gifts left. So we have Beauty Tricks MC. Finally. Yes, it's you. You won. Okay, last one. It's a big one. Dr. Navat Adel Alian, Celebrities Medical Center.